Good morning, everyone. Thank you for joining today's webinar. We'll give it another couple minutes here just to let folks join, and then we'll get started around 10:01. But happy to have you all here with us today. So I think we can go ahead and get started this morning. So welcome again, everyone. Thank you for joining us for the Walk Here's Conversations webinar. Today we'll be talking more specifically about teen and young adult caregivers. So really excited to talk more about that here soon. My name is Sebastian. I'm the Walk Here's Fund Outreach and Language Access Lead. And also excited to have Charlie and Asia as panelists for today's webinar. So I will go ahead and let them introduce themselves.
Excuse me. I'm Charlie Hoy Ellis. I'm with the Goldsen Institute at the University of Washington School of Social Work. And what we do at the Goldsen Institute is put our decades of research into action by creating community programs and trainings that help people of all ages live healthier, longer, and more fulfilling lives. And I have the great opportunity to be the Director of Interventions and Training with the Goldsen Institute. So that's the hat that I'm wearing here today.
Awesome. Thank you, Charlie. And Asia, if you'd like to go next.
I am Asia Cheslick. So currently I work for Kitsap County Aging and Long-Term Care, specifically on the Walk Cares program for our AAA. I am here also in the capacity of having been a caregiver as a teenager. So I won't spoil it. We'll dive into a little bit of my story and kind of how I ended up where I'm at now.
Awesome. Thank you, Asia. Thank you both for sharing that. Really happy again to have you here with us today and to hear what you'll be sharing here soon. Just a few housekeeping things before we do get started with the material. Anyone who's joined us on a computer or using the Zoom app on their phones can submit their questions through the Q&A function at any point in the presentation. And if we're unable to answer your question during our time today, you can email us through the Contact Us form on our website, walkersfund.wa.gov/contact, to get a response and answer to your question. Today's webinar will be recorded, so the recording, along with the slides that we shared today, will be available on our website at walkersfund.wa.gov/webinars within 24 hours of the completion of today's presentation. And with that, I am going to start the presentation today by providing a brief overview of long-term care. And after that, I will hand it over to our panelists. And then after our panelists, we'll get into more details on the Walk Cares Fund and how it works. So just to kind of set the foundation around long-term care, I'm sure many of you here today are already familiar with what it is, but again, just to make sure we're all on the same page to start, long-term care is help with activities of daily living, so things like bathing, eating, moving around, and managing medication. but it does not include medical care. Excuse me. So things like doctor's visits and treatment for medical conditions. In-home care can support someone's mental and emotional health in addition to the physical health that they may need. A study done in 2025 showed that home care significantly reduced symptoms of depression for people receiving care. It improved their quality of life and lowered the risk of loneliness. So, with the right support, most people with long-term care needs can keep living independently in their own homes. There are also several misconceptions around long-term care. One of those is that it's very common for family caregivers to not realize that they are, in fact, a caregiver. And I think particularly in the case of teen and young adult caregivers who may be caring for a loved one, right? So things like going to your mom's house a couple times a week to cook meals, drive her to appointments, making sure she's taking her medications, all of which are common care activities, and again can be looked seen as maybe just helping, right, or assisting a family member. Um, Most of this type of care, family caregiving, is provided informally as unpaid care, and usually from a family
Oh,
member,
yeah.
also be a friend or a neighbor. And just to highlight a few things before I hand it over to Charlie. First, that we are all at a high risk of needing long-term care. We know that about 70% of us will need long-term care at some point in our lives. And that risk can come with very high cost. So just as an example, as we can see there, getting 20 hours of home care each week for 6 months costs about $23,000 total. And even if someone has a family caregiver that is able to provide care, it's also important to keep in mind the financial impact, right, that that can have on um, the caregiver, um, and as well as right, mental and emotional as well. And as we mentioned earlier, because long-term care is not medical care, it's not covered by health insurance or Medicare, except in some very rare circumstances. And then it's typically only covered by Medicaid after someone has spent down their life savings to just $2,000. So with that, I do want to hand it over to Charlie to speak to his work and the programs that he works with.
Thank you, Sebastian. So the Goldsen Institute never had a formal launch date. It kind of semi-started back in the mid-90s. We've always looked at the social determinants of health and mental health outcomes, so those upstream factors that trickle downstream to cause people so many challenges. The one of our big studies was the National Health, Aging, Sexuality, and Gender study. We followed, are still following 2,450 adults age 50 and older across the United States, and we collect data from them every 2 years. And that data is the basic research data. So that's identifying risk and protective factors. And then we take that really valuable information and take it over to our intervention unit where we develop interventions. So probably the most embedded factor in the social determinants of health is the chronic stress that people experience across the life course, and that what we experience early life. So, for example, young caregivers today, caregiving itself is stressful on top of day-to-day stresses. And so, stress that young people are experiencing today very often gets embodied and they carry it with them across their life course. And so that increases their risk for poor mental and physical health outcomes. Next slide, please. So we are very grateful to be able to bring powerful tools to caregivers to Washington State. I know there are many different people providing powerful tools for caregivers classes. PTC is owned by Iowa State University, and we are contracted at the Goldsen Institute with DSHS to be able to bring powerful tools to caregivers, expand both the access and accessibility in Washington State. And so we typically offer three class leader workshops and 6 caregiver classes in any given year. The classes are 6 weeks, 90 minutes per session. So, for example, every Monday from 10 to 11:30. And size of the classes are typically anywhere between 8 and 12. And the classes are designed for the caregiver themselves. So how to help them take better care of themselves while they're taking care of somebody else. It includes everyone who participates. There's no charge for anyone to participate. So there's no cost to register or anything. And everyone who participates gets a free copy of the Caregiver Help Book. And so that's about 230 pages. The first half of the book mirrors the curriculum, and then the second half of the book uh, it has specific resources for needs that are often unique to caregivers. So dad's no longer safe to drive, and we need to take his keys away, and he's not going to let us take his keys away. Or maybe mom can't take care of herself anymore. Maybe she's not safe to live alone. So what are we going to do about that? So lots of great resources there. So you can access all of this on our website. You'll see that first purple box. It says find a class in Washington. That'll take you to our website. And we have a calendar that lists all of the classes that we currently have scheduled. And you can click on any class that looks interesting and register online. That sends your registration to us. We look it over, make sure everything's hunky-dory, and then send you a confirmation. Next slide, please. One of the challenges that caregivers, regardless of whether they're younger, middle-aged, or older, is finding resources. So we try to provide as many resources as we can. So in addition to PTC, Powerful Tools for Caregivers, these are some of our other programs that we've developed. So Legacy Letters is an intergenerational program to bring older and younger people together. It's a 6-week class. There are lots of activities at the end of the class. The product is each person has written a letter. This is what I wish you knew about growing up in my generation. Idea Care Cafe is an intervention for caregiving dyads, so care partners, and that's for people 50 and older. It's based on the reducing disability in Alzheimer's disease. No charge for that. Safe Home, we go into long-term care settings and provide culturally responsive trainings on best practices for providing culturally responsive care to underserved communities. Safe Care is very similar, except we go into a lot of different places, do a lot of different things. So all of our trainings are evidence-based, based on our research and the research of others. So we're constantly developing culturally responsive trainings. Next slide. So when you go to our website, if you click on Innovative Programs, they're at the top under the purple banner where it says Goldsen Institute. That'll take you to the page where you can register for a class and all of that. If you click on the resources button, it'll take you to this page. So we try to find as many resources as we can that are relevant to caregivers. And again, this is all freely available on our website. Next slide. So these are just a couple of selected quotes from people who have gone through some of our trainings and programs. One said, "I need you to hear something. You've made such a difference in my life, helping me see things I wasn't willing to admit. I just kept everything on the surface to hold it all together. The program is so different than what I expected and so important. Thank you." And then the other one, "I thought I was doing the program for my loved one. Turns out it was for me. I've had an enormous breakthrough admitting my vulnerability, my needs to my grown son." Next slide. And this is us in living color, and this is all of our contact information. So when the slide decks are sent out after the webinar, please feel free to contact us. Thanks. That's it for me.
Awesome. Thank you so much, Charlie. And next, I'll hand it over to Asia.
All right. Thanks, Sebastian. So again, my name's Asia Cheslick. So I work for Kitsap County Aging and Long-Term Care. And I also was a caregiver a couple times as a teenager. Um, I won't tell you how long ago that was. Um, it wasn't recent, but um, some of the things that I learned as a caregiver, especially as a teenager, have really shaped my life as an adult, and the things I've been able to manage, and also the career path I've chosen. Um, so just a kind of a little short story about my time as a caregiver. So the first true caregiving role I took on, I was probably about 17. There was a older gal who was in the church that I attended as a child, who was in her 90s and was going on to hospice care, and had no family in the area. And so, being a teenager, with time and energy, I became her overnight caregiver. And then during the day, I would do light housework and that sort of thing while somebody else was providing care. Um, it was it was a very eye-opening experience for me, especially as a teenager. Um, there was definitely times where there was some fear of hurting her, of not being capable of doing it. She was a wonderful lady and was very grateful and understanding of, me being 17. Um, but it was definitely a thing, had I not had the support that I had from family, from friends, from the patient themselves, it would have been a very different story. Um, she was on hospice, so it was the end of her life, which was also a very life-shaping moment of being there in somebody's final days. Something that has definitely stuck with me throughout. Part of the reason that I've worked in healthcare for so long, and in high acuity clinics, was because of that experience of being with somebody um, in their last moments. So then my other experience as a caregiver was a little bit closer to home. It was my grandmother. And that
Mm.
went on from I was about 18 through 19. And I became her primary caregiver. So she lived in Ohio. She came out to visit us and fell and broke her hip, and was in her late 80s and had lived alone since my great aunt, her sister, had passed away. And so she needed round the clock care. So she ended up, after her rehab and that sort of stuff from breaking her hip, not returning back to Ohio, and so living with myself and my parents here in Washington. My mom runs a business, so I had finished up Running Start. So I was kind of in this limbo period, and my mom said, "Hey, instead of going and getting a job, how about you be your grandma's primary caregiver?" And um, so we had a deal. It was 5 days a week. Um, but I was her full-time caregiver. She was also legally blind and had early onset dementia. So there was a lot of challenges in that. Um, Not just in the providing her care. I think the things for me that I still remember to this day being the most, um I don't want to say, like, they were probably the hardest things to deal with as a teen caregiver, was the the public's kind of perception. Um, so one of the things my grandma really enjoyed doing was she loved to go out and go for walks. She loved to go out to eat. And so I would take her. And again, I'm 18, 19 years old. Um, and I would be out. And again, she was blind and she had dementia. So there were times when we would be out in public where she would have struggles, having hard times remembering things. She would forget who I was a lot of times. She oftentimes referred to me as though I was her daughter, as though I was my mother. Or her at one point I think I was her great niece who was at that point in her like 70s and I was 18. Um, but so there was times where I would be out with her and I would have to have a a more stern tone with her, a more to kind of bring her back. Things that she would forget to do. She would forget to chew her food a lot of times when we'd be out to eat. She would forget to swallow, and so I'd have to be telling her, "Grandma, you need to chew your food." And if she was in a moment where I couldn't refer to her as grandma because that would upset her. I would have to use her name. And, sometimes, and she was also a little bit of hard of hearing. Um, so sometimes I had to be a little bit louder in the public places. And I remember specifically there was one time where a waitress came up to me and was telling me that, I needed to show her respect. And I was like, I'm telling my grandma to chew her food. She has dementia. She's forgetting and she's going to choke. It's a safety hazard. Like, I have to do this. I have to tell her these things. And the lady was quite rude about it. Um, and she was like, you need to call somebody else. And I was like, this is my job. This is what I do. I am her caregiver. I am here every day. I understand her needs and her limitations. Um, and so that was very difficult for me. Of people, I had doctors when I would take my grandma to the doctor who would be like, "Oh, you're too young to be doing this." And I'm like, "But I'm not because I'm doing it and she's well cared for. She's well taken care of." Um, and I think that was the hardest thing. And it also then sometimes would make me question my own abilities, full well knowing that I was capable of taking care of my grandmother. Um, you know, and again, with her dementia, there were times where she would, again, forget who I was. She would forget where we were. The hardest one was she would forget that her sister had passed away years before. And so I would have to remind her sometimes that she couldn't see her sister because her sister was no longer with us. And sometimes that happened in public. And then I would have to manage the emotional side of things. And people would try to step in and they would make it worse because, again, I knew the backstory. I was there. And so that was a thing for me as a teenager that was very difficult because also I didn't want to be disrespectful to the other adults and say, go away, I've got this. Um, but just that misconception that because I was a teenager, I clearly didn't know what I was doing. Um, and that is a thing that I think as we have this conversation around young people being caregivers, um, there's a misconception that teenagers aren't as capable as adults, or aren't even as resilient. I think about in the description of this, they're talking about kids who struggle with going to school because they're a caregiver and that sort of thing. I worked in a high school for a long time and I saw a lot of kids who were caregivers, or who had things just in life that were going on that were very difficult. And as adults, there was this misconception that the kids should be able to deal with it. They shouldn't have emotional breakdowns. They shouldn't have frustrations. They should always show up to class on time. They shouldn't miss days. When we as adults, I mean, how many of us sometimes take a mental health day because we're just so overwhelmed with life and work and all of those things, but we expect teenagers to not have those needs when they have those needs even greater than adults. And that was something that I experienced as a teenager, as a caregiver, was again, and I did not have a close relationship with my grandmother prior to her getting sick. She was very distant, as she wasn't the coddly grandma. We didn't make cookies together. We didn't do any of that. So, so sometimes when somebody has dementia, when they're going through those things, it can get frustrating. It can get exhausting. It's hard work. And then with the emotional baggage of, like, again, I did not have a connection with her. She was not, it wasn't warm, cuddly grandma. Um, and so sometimes, yeah, I was probably short with her. Um, but that's okay. So especially as a teenager, the public stigma around it, was the hardest thing. And that's a thing I would like to see change. Is how do we help encourage teenagers who are in this position, especially if they're in a position where caring for somebody isn't a choice, or isn't the person they would really like to be caring for, of instead of putting them in a hard position and making their jobs harder, saying, wow, that is a huge undertaking for a young person. You're going to develop great skills. You're going to develop um character. And in some cases, you're breaking generational trauma by taking care of somebody who maybe didn't take care of you. And acknowledging that and saying those things to people. That's what I would encourage any of you who interact with a young person taking care of somebody, applaud them for it. Don't question if they're getting good grades, if they're managing school, and offer to help in a meaningful way. Don't interject when they're doing their caregiving, but say, hey, if you're in a position where you can help take over some of those caregiving responsibilities, give them a break. Say, hey, do you want to go to the movies? Do you want to go hang out with your friends for a minute? I can step in. Those were things that were were valuable to me and helped me be able to sustain, um, or when I was being frustrated with my grandma for, you know, again, no fault of her own. Dementia is a bugger. But having somebody say, "Hey, why don't you take a break? Why don't you take the afternoon off?" And not being like to go do homework, to go do just do whatever you need to do to refill yourself, were huge things. And the other thing, being in the position I'm in now, this is part of the reason that the going to work on the WAS Cares program, was something that I feel is important, was because, again, I was a caregiver, and I had the benefit of it being a paid position, um, as a teenager. Um, and so using that as a job experience, it helped build my future. And I think for so many young people, kind of like Sebastian was talking about, there's a lot of things that caregivers forget are caregiving, that are jobs, that are tasks. And so as a community, helping teenagers be able to take that and put it on a resume, put it on a college application, those sorts of things. And if the caregiver and the receiver choose to make it a paid position, using that as a job skill, using that as an official job to build a career. We have so many jobs in healthcare that are desperately needed, and this can be the door to open to make a sustainable uh, future, as well as make people who truly care and have experience in these things. Um, I think it's a huge undertaking, and I think as a community, and especially those of us who work in the fields, can really help these young people build a long-term lasting life and help kind of remove some of that self-doubt and mental toll that it takes by just being encouraging and offering long-term solutions and saying, hey, this is going to help. This can build your future. This can be something you're really good at. This can be something that can help, again, set you up for success later in life. And just applauding the work instead of saying, oh, wow, you're so young. Because most people who are caregivers as a young age, mentally have had to grow past their age and are kind of giving up those teenage years in order to be responsible more than any of us really should have to be. And so finding ways to acknowledge that and encourage that and use it as a positive instead of a negative. Um, that's really, yeah. So just being encouraging, I think, is a huge thing.
Awesome. Thank you so much, Asia, for sharing that. I know I'm seeing a lot of reactions come through, so I know there's a lot of appreciation for folks who are hearing your story. So I'm gonna transition into the Walk Cares program from here to talk about kind of like Asia mentioned, right, how Walk Cares kind of fits into this and how Walk Cares can potentially help a lot of caregivers and families. So let me go ahead and share my screen again. All right, and after we go over the Walk Cares overview, we will have time for Q&A. So any questions that you will have, you're welcome to, again, enter them into the Q&A function in the toolbar. So a public insurance program like Walk Cares gives workers a more affordable way to pay for the long-term care needs by allowing them to contribute while they're working, and so their income is higher. And then they can access money to pay for the care that they need later in life when they're on fixed income. Covering all workers also helps keep contributions low, and once someone retires, those contributions stop. This approach to paying for long-term care is also more affordable than private insurance at the time when people access care. And unlike private insurance, which typically requires someone to pay out of pocket for 90 days before they can access benefits, Walk Cares has no deductible or waiting period. So to earn Walk Cares benefits, most Washington workers automatically contribute 0.58% of each paycheck during their working years. And again, you only contribute while you're working. So if you retire or if you become unemployed, those contributions stop. Contributions began July of 2023. Everyone's covered at the same low rate, regardless of pre-existing conditions. You'll need to meet a contribution requirement and a care needs requirement. And once you're approved, you can choose how you want to use your benefit. So currently, the full benefit amount starts at $36,500, and that will grow with inflation each year. That benefit can be used for any covered services and supports, again, that you choose and that you want. There are no out-of-pocket costs when you need care. So we pay the providers directly for the services that you receive with, again, no copay or deductible. Just to give a sense of what those contributions look like over the course of someone's potential career, if we focus in kind of on that middle column there, a typical worker participating in Walk Cares who makes about $59,000 a year, they are paying $29 in contributions per month, which adds up to just over $10,000 total over a 30-year career. So everyone who is contributing to the Walk Cares Fund more than 500 hours per calendar year is earning benefits, and that includes part-time and temporary workers. To qualify for benefits, you have to meet the contribution requirement through one of these, the three pathways there on the screen. So first we have the permanent pathway on the left there, which will earn someone lifetime access to the full benefit amount by contributing for at least 10 years, and this is at any point in their career. Then we have the temporary pathway in the middle, which will earn someone access to the full benefit amount if they've contributed for at least 3 of the last 6 years at the time that they apply for benefits. This pathway is designed for people who have contributed recently at the point when they need care, but maybe haven't earned that permanent access yet. So this year, applicants who have contributed for 3 years at any point in the program can qualify through this pathway. And then we have the transition pathway, which will earn someone permanent access to 10% of the full benefit amount for each year that they've contributed. This pathway is specifically for folks who were born before 1968. So let's say someone has contributed for 2 years, they would then earn 20% of the full benefit amount, which is currently $7,300. And this pathway is designed for people who are near retirement when the program launched this year. So they might not be able to, again, earn permanent access to that full benefit amount, but will have access to a prorated amount based off, again, those number of years that they have contributed. Although these workers can also earn the full benefit if they qualify through one of the other pathways. So if someone initially qualifies through the transition pathway for a percentage of the benefit, but then maybe takes a part-time job after retirement and continues contributing, they could access, again, the full benefit amount through one of the other two pathways. To use your benefits will determine that someone needs help with 3 or more activities of daily living and will also continue to need help for at least 90 days. So those activities of daily living are the ones on the screen there: bathing, bed mobility, transferring, toileting, mobility, eating, and medication management. We'll also count any activities that someone needs supervision to complete. So someone monitoring the person needing care, reminding them to start or keep going on an activity, or helping them set up for an activity. When someone's ready to apply for benefits, they'll start by creating an online account. If that person needs help managing their account, they can set up an authorized user, and that can be a loved one or also a legal representative. You can also get help with your application from the local area agency on aging. They have dedicated staff that will be able to assist with the application process. Or you can also apply over the phone. The phone number to call is the one there at the bottom of the screen, the 844 number, Care for WA. Once you submit your application, we'll confirm that you've met the contribution requirement, again, through one of those 3 pathways. And then you'll be able to schedule an appointment to talk about your care needs. After we meet with you for that care needs assessment, we'll let you know if you're approved to start using your benefits. Once someone has been approved, they can use their benefits for any covered services and supports from a WA Cares provider. So this is the full list of services and supports that someone can choose from. And of course, the way that someone chooses the service depends on their preferences, right, and needs. But someone may want to choose services to help them stay in their own home. So things like in-home care, home modifications, home delivered meals, also adaptive equipment and technology are all covered, as well as services that support family caregivers, as we've been talking about today. So someone can get paid care from a loved one, including their spouse or a family member. They can also get respite care, as Asia was mentioning, the importance of that, so that that person can take a break. We also cover education and consultation to help them manage your care, dementia behavioral supports, as well as care transition coordination to support someone when they leave a facility like a hospital. We also cover services that are in your community, so adult family home, adult day services, as well as assisted living facilities, nursing homes, and including memory care. So just to give a sense of really how far that benefit amount can go, we know that about a third of people need care for a year or less. So for those people, depending on the services that they choose, WA Cares may be able to cover all or most of the care that they need. For others, WA Cares will be able to provide the family with immediate relief and also time to be able to plan for future care costs, right, and future care steps. So these are just some examples of how someone could use their benefit. If they would like to pay a family member for care, for example, they can receive care for 10 hours per week for 2 years and also get care supplies for under $35,000. If they want to make their home more accessible to be able to keep living there independently, they could make home modifications, install a personal emergency response system, and also get meals delivered for 3 years for just over $36,000. Or if they need maybe short-term help after an accident, they could get in-home care for 20 hours per week for 6 months, install a ramp, and also buy safety equipment for less than $29,000. WA Cares provides a modest benefit for a modest premium. So some folks might want additional coverage in case that they need care for a longer period of time or if they choose a more expensive facility. So the legislature has created standards for supplemental private insurance policies that are designed to work alongside the WA Cares benefits. It's similar to how Medicare works. The public insurance provides a foundation of financial security for everyone, and then private options are available for those who want additional coverage. The supplemental private policies will kick in seamlessly once someone has used their Walk Here's benefit. And the supplemental market will also give consumers options for coverage amounts and prices. But the policy should be more affordable than current private insurance policies since Walk Cares will cover the deductible. In terms of the timeline for the supplemental policies, the Office of the Insurance Commissioner has completed rulemaking earlier this year, and those policies could become available by early next year, 2027. So you can also choose to continue participating in Walk Cares if you leave the state. In order to become an out-of-state participant, you have to have contributed for at least 3 years, working at least 500 hours or more per year. And then you also have to opt in within a year of leaving Washington. Out-of-state participants will keep contributing to the fund during their working years, and those benefits will become available for out-of-state participants starting in July of 2030. And with that, that does bring us to our Q&A section. So feel free to um, enter those questions there in the Q&A function. I think I see a few already. If a beneficiary can have multiple paid caregivers, especially both family and through a care provider, particularly for folks who live in a multi-generational household with multiple family members assisting with care. Um, that's a great question, Joel, and Sam, I may rely on you a little bit for this one. My understanding is that yes, someone can choose, right, the services, in this case, caregivers that they would like. So they could have a family caregiver and then have another care provider. But Sam, I'm not sure if you have any additional details that might be helpful for this one.
Yeah, that you're right, Sebastian. You can have multiple paid caregivers, so you can even have multiple family members, or you can choose to use your benefits however you'd like, as long as you don't go over that maximum benefit amount. And every caregiver you are using is a registered caregiver.
Awesome. Thank you, Sam. What tool guide is used for the benefit inflation rate? It is the consumer price index for the Seattle area. So again, the benefit amount currently is $36,500. Starting January of next year, the benefit amount will be adjusted for that inflation rate for, again, the consumer price index of the Seattle area. Is there a reciprocal program with other state long-term care programs? Any plans for future coordination with other established programs? Uh, at the moment, Terry, there aren't any reciprocal programs in other states or with other long-term care programs in other states. Walk Cares is the first of its kind really in the country, so Washington's kind of leading the way with a program like this. Other states are looking towards the Walk Cares Fund to potentially incorporate a similar program, but at the moment it's the first of its kind. And there's really no other coordination with other states beyond folks being able to access their benefit, as I mentioned, if they move out of state, right, and being able to use their benefit in a different state starting in July of 2030. Um, and then I do see there's a question regarding number of home care agencies. I think I don't have that information in front of me, but I think we can definitely follow up with more specific numbers for that one. If they do want to find home care agencies, we do have our provider network directory online, and that directory shows all the listings for all the registered Walk Cares providers. They can search by the type of care that they're or type of service that they're looking for, as well as the area that they're looking in, and match which home care agencies are in their area. I think that's all the questions I see so far, but feel free. We do have time for more questions, so if folks have any other additional questions, feel free to enter them in the Q&A function there. We can answer your questions. I'll wait another minute to see if we do get another question. Um, I guess since we do have some more time, okay, I do see a question, and then we'll keep moving. How can school districts help student caregivers? Um, I I guess I might ask you, Charlie, or maybe both of you, Asia and Charlie, if you have any um, insight or information there that may be helpful. From my end, I don't think I have anything to provide for that answer, but yeah,
I
you
definitely have
all.
some.
Yeah, I thought you all might. So yeah, go ahead.
Um, so I worked in both a community college and a high school, um, in different roles, but I worked very closely with students. I think one of the biggest things that I saw from students who were either, taking care of younger siblings or parents or grandparents or whatever, um, was again that expectation that they can do it all. So I think from a school district's perspective, um, the being supportive, understanding, um, that being if they're late on a homework assignment because they have a legitimate reason, and I trust me, I heard every excuse under the sun from teenagers, including my own teenagers, as to why their homework's not done on time. Um, but if you know somebody is leaving school to have to take somebody to the doctor, if they're having to, um, if they were up late because, somebody had to go to the hospital, somebody had to, they just had a bad day. Let them have a bad day. Um, Give them space to say, and a lot of times they don't want to talk about it. Just let them have a bad day. Let them not interact. Um, but also give them that space to come to you and say, I'm struggling. I don't know what to do. I need help. And it could just be something as simple as, I need a place to do homework without having a responsibility around me. I need 10 minutes in a classroom quiet by myself to complete a homework. I need you to help me do my homework because I don't understand it because I don't have somebody at home to help me with it. Those are things that I saw all the time that were most valuable for these kids.
Awesome. Thank you.
One thing I would add to that,
Yeah,
thank you,
great.
Asia. Those are very good points, is schools can actually be an excellent resource in terms of having resources for youth caregivers. So often, just looking for services, resources like respite care, things like that can be very, very time consuming. So I think that would be a great place to have information about resources readily available.
Awesome. Yeah, I think those are all great suggestions. Thank you both for sharing that. Um, and then follow up on the how folks can find agency options. That provider network directory is available to the public, so if someone doesn't have to be a beneficiary to access that directory, so anyone can access that directory and look as they're applying or before applying to look at their options. Um, Mel, regarding your comment, thank you for highlighting that. What I meant to say is yes, folks who move out of state will be able to use their benefit again starting July of 2030. What I was referencing is that WACARES does not work with any other long-term care programs that are in other states, which is what the original question, if I'm remembering correctly, was referencing. So yes to, of course, the WA Cares benefit being available in other states starting July of 2030. Um, and then the recording as well as the slides will also be available on our website. So if you missed something from today or you want to review something on the slides, they will be posted to our website um, uh, shortly, within 24 hours. So you can review and again look at some of that information again there. All right, I think those are all the questions I'm seeing. I guess just to kind of wrap up before we do our final housekeeping, if Asian and Charlie, if you don't mind sharing kind of one last final reflection that you all would like to leave with folks who are with us today. And we can start with you, Charlie. Go
I keep forgetting to unmute myself.
ahead.
So I think the key takeaway for all of this is caregiving itself is not necessarily the problem. It's unsupported caregiving. And resilience, we really shouldn't use that to suggest that young caregivers ought to manage alone. It's hard enough as adults to get the support we need, but younger people, they don't have as large a social network, maybe, or maybe different types of social networks. So it's any support that we can give them is going to pay off in the long run.
Thank you, Charlie. And Asia, any final remarks you want to leave folks
Yeah,
with?
I mean, definitely what Charlie was saying, again, um, as a I was a caregiver as an adult too. That I think in some ways, um, it was easier yet harder. Um, you know, being adult comes with way more. I had my own children at the time too. I had, a mortgage. Those sorts of things, but the toll it takes on a teenager is very different. Um, and and again, the expectations that we've set in society, I the fact that I'm assuming you work at a school district, that's how a school district can help. That is, I think, the biggest area is where are the teenagers? They're usually in school. They're somewhere like that. How do we support them and make them successful? And how do we leverage, and this would be something I would challenge if there's, caregiving agencies, the caregiving union, any of us who work on the WA Cares program and are working with these kids directly, how do we leverage that into long-term support for building a career? How do we make it a career path? It's something we need in society. I can't tell you how many I taught healthcare administration. I had employers knocking on my door every day looking for people. Um, so how do we leverage that into taking this into allowing kids to see that this can be beneficial and not just a burden for them, but it can help build their future and their careers and make them successful and help other people too.
Awesome. Those are great. Thank you, Asia. And Charlie, I did see a couple more questions just come in that I think are definitely relevant to today's topic. One is how old does someone have to be to become a caregiver or to get paid by Walkers? And for someone to use their Walkers benefit, they have to be 18 years, meaning that they are the person applying for the benefit. But someone can contribute before they're 18, right? So whenever they're working, doesn't have to be they don't have to be 18, right, to start contributing. As long as they're working, they are contributing to the Walk Cares Fund. Um, all right, I think that's all the questions I see for today. Again, if you have a question come up or want some clarity, feel free to again reach out to us through our Contact Us form on our website. We'll be happy to answer you there. I want to thank Asia and Charlie again for sharing what they've shared today. I think that was really, really valuable to hear both their perspectives and Asia, your experience, of course. Um, and I think we do have, let me just get to a couple other slides. We would love to hear from you all and appreciate your time to take a few minutes to share your thoughts on today's presentation. So there will be a survey that will automatically appear, pop up on your screen when you leave the meeting. So if you could take a few seconds to complete that, that would be appreciated. And then final, thank you again for joining us today. We will have again the information, the recording of the webinar and the slides up on our website soon. And there are some links and where to contact us if you have any questions. So thanks again, everyone. Hope you have a great rest of your day and hope to see you at the next webinar. Take care.